Hi guys, so I'm making this video today to talk all about ovulation. So ovulation is a huge topic and I could talk for hours about it, but I want to try and make this one short. So I want to talk about how to tell when you're ovulating. First of all, we should probably start off with what ovulation actually is. So for a lot of women, ovulation can kind of be this like mysterious thing that they're not really sure when it happens or what it is or how to tell when it's happening. And it shouldn't be super confusing. So I want to try and make it more easy to understand. And what's lucky is that our bodies have been so well and so amazingly designed that it actually gives us a lot of clues when we are ovulating. So your body actually gives you signs to tell you when you're ovulating. So your body will give you signs in the lead up to ovulation, during ovulation, and then after as well. So it's giving you a lot of help. So to talk about ovulation, I want to do a quick little recap or summary of the menstrual cycle. So the menstrual cycle has 4 different phases. We've got the menstrual phase when you have your period, the follicular phase when the follicles are growing, the ovulation phase when you ovulate, and then the luteal phase, which is the post-ovulatory phase. And then menstruation will begin again if you're not pregnant. The follicular phase is focused on growing lots of little follicles on your ovaries. So follicles are little fluid-filled sacs that each contain an immature egg. So this whole process is stimulated by FSH. So that is your follicle stimulating hormone, which is produced by the pituitary in the brain, and it sends down a signal from the brain to your ovaries to start producing follicles, so to start getting your body ready for ovulation. So during this phase of the cycle when FSH is rising to stimulate the follicles and the ovary, estrogen is rising as well. As we get closer to ovulation, FSH is rising and the estrogen is rising, and it stimulates one follicle to become the dominant follicle, and the rest of the follicles that were growing kind of recede back, and that one dominant follicle takes over, and that's the one that will release an egg when you ovulate. So as you get closer to ovulation, the luteinizing hormone, or also called LH, will surge, and that is what triggers the follicle to burst and ovulation to happen. So after ovulation, that follicle that was holding the egg turns into a different structure called the corpus luteum, and that is like a temporary gland on your ovary that secretes progesterone. So progesterone is such an important and awesome hormone in our bodies. It's good for so many different things. Oh my god, progesterone is awesome. The majority of progesterone all comes from the corpus luteum, which is this tiny little structure, little tiny gland on the ovary. So it's pretty amazing that it has such a big power in our bodies, and it comes from such a small thing. So progesterone, one of its functions, it has lots of different functions, but one of its main important functions is that it holds the lining in place. So estrogen helps to thicken up the lining, and that's all in the first phase of your cycle. And then you ovulate, and then the second phase is all about holding that lining in place, and it does a little bit of thickening as well of the lining in case an embryo comes down to implant. So if that doesn't happen, then progesterone will decrease after a certain period of time, usually 2 weeks or 12 to 14 days. And then once that decreases, the lining will shed, and then you'll get your next period. So the main thing that we care about in this video is ovulation and how to tell when you are ovulating. So there are 3 primary signs your body gives you of ovulation. So these are cervical fluid, basal body temperature, and cervical positioning. The cervical fluid is this amazing, life-giving, amazing substance that is actually so cool when you get into it. This is going on all in the background of all of those hormonal fluctuations that are happening with the estrogen and the progesterone and your FSH and LH and all of these hormones. In the background of that whole hormonal cycle of your period is the cervical fluid. So this is absolutely key for healthy periods and fertility. It is absolutely key. It's one of the most important factors. If you're unfamiliar with cervical fluid, if you're unfamiliar with this term, cervical fluid is the mucus fluid that you see with ovulation. Whether you see it on your undies or you see it when you're wiping, or sometimes you can feel it, that is the fluid during ovulation and the lead up to ovulation that gets secreted. This fluid is produced inside the cervix in the cervical crypts. So inside the cervix, I'll have to link an image because it's hard to explain. Inside the cervix are all these little folds and channels. So the cervix might be like that big, and the microscopic, all of these little folds and I guess folds is a good word, where sperm will sit in as they have a little break on their way up into the uterus. So it has like that type of function, but also there's glands in the crypts that secrete this fluid. So all of your cervical fluid, which is this amazing thing, this is where it's coming. This fertile fluid plays a big factor in whether we are fertile or not, and it also gives a really good indication into our underlying health. So just to give an example of how important the cervical fluid is, think about this. If a woman has a completely textbook, 100% normal period, everything fine, and no cervical fluid, that's considered a non-fertile environment. So even if she's ovulating every month, even if her hormones are perfect and everything's looking really good, if there's no fluid, then she can't conceive. So the fluid is very important. So one of the functions of cervical fluid is that it helps sperm to swim. So the vagina is a really acidic environment, and it actually kills off sperm if there's no fluid present. So this fluid is really alkaline, so it actually helps to keep the sperm alive, and it's a means in which they can swim through, and it's really important to help them move. So when you look at cervical fluid under the microscope, it looks like lots of little passages and channels, and that is what the sperm will swim through. So it helps the sperm to swim up through the vagina, through the cervix, into the uterus, and into the fallopian tubes, which is where fertilization actually takes place. So there are a few different types of cervical fluid, and what we really want to look for is wetness, stretchy fluid, and that like raw egg white type of presentation. That's what we want to be seeing. But sometimes cervical fluid can even be like a bit lotiony or a little bit creamier, and that's okay. But we're wanting to look for some kind of fluid happening throughout the cycle. So generally what will happen, the pattern for the cervical fluid is you'll have your period, and then you'll typically have a period of dry days after your bleed. And then as you approach ovulation, it'll start to get a bit more lubricated, a bit more wet, a bit more slippery. That's a sign that you're approaching ovulation, and that is considered the start of your fertile window. And generally, the last day that you see any fluid is your peak day of ovulation. And so say if you notice fluid for like 3 days, the third day is the last day, and the next day is when you will ovulate. Whenever you notice the fluid, that is considered a fertile time. So after ovulation, then for the rest of the cycle, if you see any fluid after ovulation, that is not fertile fluid, and that could just be some fluid that's being secreted from the increase in progesterone, and that is not considered fertile. So the only fertile fluid is around ovulation. The next sign of ovulation is your temperature. So doing a BBT chart, basal body temperature, and waking body temperature. So the reason that temperature can be a sign of ovulation, the two would seem like they're completely unrelated, but our hormones actually influence the temperature of our bodies. So tracking our temperature can actually help us to understand where our hormones are sitting, help us to understand what phase we are in of our cycle after we've been charting our temperature for a couple of cycles. And this helps us to determine when our fertile window is and when ovulation occurred. After ovulation, the follicle that released the egg turns into the corpus luteum, and that is what secretes progesterone. Progesterone is a really heating hormone. It actually stimulates the thyroid, and the thyroid is all about our metabolism, and it can actually increase our body temperature. And in Chinese medicine, the second half of the cycle is really focused on yang, and yang is a really heating, dynamic movement type of energy. That is how we can see progesterone as well, as progesterone is really heating. So if you start tracking your temperatures, you can actually tell when you've ovulated. First phase of your cycle, the follicular phase, temperature should be relatively stable, and after you've ovulated, it should spike. When you see that big increase, that is telling you that you have ovulated. And in terms of fertility, it's kind of too late to then have sex to try and fall pregnant, as you've already ovulated, and the best time to have sex is before ovulation, so that there's sperm waiting and sitting in the fallopian tubes. But in terms of avoiding pregnancy, this is really useful knowledge to know when you've ovulated, because then you know that you're not fertile now for the rest of your cycle. Tracking your temperature is really important if you are trying to fall pregnant or if you are avoiding pregnancy. It is super helpful. So tracking your temperature doesn't actually tell us when ovulation is approaching because it will only change after you've ovulated. So it's not to be used as a predictor of when you're going to ovulate. It's only kind of used after the fact. It'll confirm ovulation happened and when in the cycle. So this is when it's really important to combine it with tracking your cervical fluid, as that is what will tell you when ovulation is going to come. So there are lots and lots of different factors that can influence our temperature outside of our hormones and ovulation. So it's really important to have a really good grasp on what you're doing when you're tracking your temperature. So I recommend reading books like Taking Charge of Your Fertility or Natural Fertility, or getting guidance from a fertility awareness teacher or instructor that can actually take you through tracking your temperature, because it can be a little bit complicated when you first start, and it's really important that you're getting the right information and that you're doing it correctly. So the third thing that can help you know when you're ovulating is the position of your cervix. The cervical fluid isn't the only change that your cervix experiences during ovulation. It actually also changes in position. In a normal menstrual cycle, after your period, the cervix will be sitting quite low in the vagina, and it'll be quite firm to touch. It won't have any lubrication at all, and it'll feel kind of firm like the tip of your nose, and that's super normal. When you get closer to ovulation, the increase in estrogen actually has a lifting action on the ligaments holding the uterus in place, and it actually lifts your uterus upwards, which is amazing because in Chinese medicine, ovulation is a really yang and lifting phenomenon, and it's amazing that the body actually lifts as well. So when you're close to ovulation, because the cervix is sitting higher, it will actually feel different. So you just stick your finger on up there and have a feel, and your cervix will start to feel like soft like your lips rather than like a bit firmer like your nose, and you can kind of feel that the opening of the cervix is bigger, and there'll be lubrication there because that is the cervical fluid. After ovulation, the cervix goes, because there's been a drop in estrogen and you have finished ovulating, the cervix actually drops back down again, and it'll feel the same as it felt after your period. A bit lower, it'll feel a bit firmer, and it'll feel closed and dry, like there'll be no slippery fluid there. So the cervix really is this amazing part of our bodies, and it acts like a gatekeeper during your cycle. So it actually is closed when you're not ovulating, and it doesn't let sperm get through. So even if you're using this as a contraception, doing the fertility awareness method, when you're tracking your cycle and tracking your cervical positioning, if that cervix is closed, not close to ovulation, no sperm is getting through. So there's no chance of falling pregnant when you're not in your fertile window. And then of course, as you approach ovulation, the cervix opens up because it's the time that it will let sperm through. So it's quite selective in its times of when it likes sperm being there and when it doesn't. These three signs can help you to really hone in on your body and really get to know it really well and track your ovulation naturally. So tracking your cervical fluid and paying attention to it, tracking your body temperature, and paying attention to the positioning of your cervix. There are also some other ways to tell when you're ovulating. So some of these signs are not concrete and shouldn't be used 100% as the only way to tell when you're ovulating, but some are. So the first one is ovulation predictor kits. So these are super common when you're trying to fall pregnant. They will tell you when your estrogen is rising and when the LH is surging, and that will give you an indication of when ovulation is coming. Now this isn't great if you have polycystic ovarian syndrome, as you can have higher levels of LH during your cycle, kind of regardless of where you are in your cycle. This could give inaccurate readings. So you should always be working with a practitioner to be able to guide you on exactly what would be the best method for you to track ovulation. As always, should always be combined with tracking the cervical fluid. Ultrasound is another way that we can track ovulation. So women that are going through ART, assisted reproductive techniques, will be very familiar with the ultrasound. So it's really common, obviously, going through IVF. But if you're going through like a Clomid cycle or doing IUI, uterine insemination, they'll often track when you're ovulating, and they'll do that through an ultrasound, as they can actually see when that follicle is getting close to releasing an egg. A blood test that you can do to see if you have ovulated is a progesterone blood test. Progesterone, obviously, as we've spoken about, will spike after you've ovulated. So doing a progesterone blood test 7 days after you've ovulated will tell you if you've ovulated or not, and tell you the strength of your luteal phase. So this is a really common test that I get women to do. If it seems like their luteal phase is a little bit too short, that can indicate the progesterone levels aren't strong enough. So doing a progesterone test can actually tell us where your progesterone is sitting, how strong that luteal phase is, and from a Chinese medicine perspective gives us an insight to the yang quality of your body. Some other signs of ovulation that women can get are some dull pain. So some women can actually get what's called Mittelschmerz, which is ovulation twinges or pains. Some women it can be really, really mild, just feels like a little dull sensation or awareness when they're ovulating. Some women can actually get quite sharp pains, which should always be investigated, but getting some pain around ovulation can actually be quite common, and some women don't get anything at all and can't tell just from sensation in their tummy when they're ovulating. So this one is kind of person to person. Some women can notice an increased libido around ovulation, and this is just Mother Nature's way of getting us to reproduce. Not every woman feels this, but a lot of women do notice that their libido will increase around ovulation, which makes sense. So our mood typically will change with ovulation because this is like the pinnacle of the cycle. Ovulation is the absolute main event of the whole menstrual cycle, because without ovulation we wouldn't have periods or hormones. So ovulation is super important, but because of this energetic big build up, and it's a really big yang experience in the body, your confidence is just like right up here, and you feel really more outgoing, and you feel like more focused, feel more grounded, you get more ideas. And ovulation is a great time for a woman, and a lot of women notice that their moods feel really good during ovulation. One thing that I want to cover that definitely doesn't tell us when we're ovulating is period tracking apps. So please do not use these as your sole way of predicting when you're ovulating. These apps are merely just averaging out whatever cycles you've put into the app, is just giving an average and is predicting when it thinks you're going to ovulate. The app doesn't know your body. The app doesn't know what has influenced your body this cycle that impacts when you're going to ovulate. So don't use this as your sole guidance of when you ovulate. Whether you're trying to use it to conceive or trying to avoid pregnancy, don't do it, because it is 100% not accurate. You want to focus on the 3 factors that we spoke about earlier: cervical fluid, temperature, cervical positioning. This is telling you exactly what's going on in your body right now. The app is just a prediction, so please don't use that as your only way of knowing when you're ovulating. You can of course combine it with those other 3 things, but just don't let that be your only one. So yesterday on my Instagram, I asked you guys to send me some questions, and I've covered quite a lot of them already during this video, but there are a few others that were asked that I want to cover now. So the first question was, can you ovulate without cervical fluid? And the answer to that is yes. You can ovulate and not get any cervical fluid, and that indicates a hormonal imbalance or some kind of imbalance going on, because we should and need to be getting cervical fluid with ovulation, lead up to ovulation and during. So if there's no fluid, we want to investigate that. But we also want to get clear on what kind of fluid you're seeing, because a lot of women think that they don't get any fluid because they're not paying attention to it multiple times every day. When you're tracking your cervical fluid, you need to really be on the ball, making a conscious effort to look for the fluid multiple times a day, because your body will go for fluctuations. So if you're not doing that, we can't 100% say whether or not you're actually getting fluid. It needs to be something that's more tracked with a practitioner or whoever you want to work with. Next question I wanted to answer: possible to conceive without cervical fluid? And the answer to that is no. The sperm need the fluid to survive. If there's no fluid there, they just die. They're very sensitive and they need the fluid there. So if there's no cervical fluid, you can't get pregnant. The next question was, what is my opinion on using pre-seed lubricant if there isn't a lot of cervical fluid? And my opinion is always, why isn't there cervical fluid? So I have no judgments on whether you want to use lubricant or not, but if the reason that you're using it is because you don't have any cervical fluid, let's look at why there isn't fluid, because that can indicate some kind of imbalance in your body. And so instead of kind of masking that with lubricant, let's actually figure out why that you don't have fluid yourself, and that can be corrected so that you don't need lube anymore. So many different factors that can influence our cervical fluid. So my approach would be to address all of those factors first and then assess whether or not you actually need any lubrication. The next question was how to track ovulation if you have PCOS or polycystic ovarian syndrome. So it's just the same as any other cycle. So with PCOS, you're only ovulating once in a cycle. So all of those ways that you can track ovulation still apply. So you can still track your cervical fluid, you can still do your temperature, you can still do your cervical positioning. That is all still relevant for PCOS. But what can happen with that is that usually with PCOS, there's longer cycles, so there's likely that you're just going to spend more time tracking your cervical fluid. You might get a few attempts at ovulation in a cycle. More, you need to be on the ball with making sure that you're doing your fluid, and then tracking the temperature would be really helpful for PCOS, because then you can determine exactly when you have ovulated. I just wanted to finish off by talking a little bit about taking the pill and cervical fluid. So one of the functions of the oral contraceptive pill is to dry up cervical fluid, and that is one of the ways that it is a contraceptive, as a way it prevents pregnancy. As we know, the sperm needs fluid to swim in. So one of the pill's functions is to dry up that fluid. So a lot of women that I see that have been on the pill for like a lot of time, like 5 to 20 years, have no idea what I'm talking about when I say fertile cervical fluid, because they haven't seen it, because ovulation has been suppressed and they haven't been producing any fluid. So when women come off the pill, they're trying to fall pregnant or they just want to stop the pill, and then they're getting into the rhythm of actually tracking their natural cycle, they're not really sure what to look for with cervical fluid, because they haven't seen any for years. So it's nothing to be concerned about if you don't see any fluid, but it's something that can come back. Just be aware, if you are on the pill, you won't be getting any of this fluid, but when and if you stop the pill, that's something that you want to be keeping track of, and that's a way that you can track your cycles off the pill. Now, ovulation is such an important and amazing part of our bodies. It's where we get our hormones from, and it's really important for women's health in general, and then definitely for fertility. And so whether or not you are trying to fall pregnant, tracking your ovulation is really, really helpful for understanding your cycle, and doing these different things like tracking your cervical fluid, doing your temperature, and tracking your cervical positioning can help you give a really good idea of when you're fertile and when you're not, and be very accurate with that. And it's something that many women use as their sole means of contraception, and that would be called the fertility awareness method. So this is the method that I use myself, and I love it because it's something that doesn't interfere with my future fertility at all, and it's something that I can do myself, and I'm kind of in charge of my body, which is amazing. I don't have to rely on anything else but myself, and it's something that's really important to get a lot of guidance to do before you go and use it as your sole means of contraception, if you want to use it for that. If you're just using it to track your cycle and get to know your body better, I 100% love that and think that everyone should be doing it if they want to. Well, I hope this video clears up any questions you may have had about how to tell when you're ovulating. If you do have any questions at all, or any other questions about ovulation or fertility or women's health, please send them through and I will be more than happy to answer them in my next video.